Hello, everyone. Welcome to SIND Biotechnologist Association, where you get to know about science. And today I'm thrilled to talk about something that's not just changing healthcare globally, but right here in Pakistan, telemedicine. So tell me how many of you have heard of telemedicine, or maybe even used it during the pandemic. It's okay if you have or haven't. In this video, we will talk about how telemedicine is helping to bridge the healthcare gap in Pakistan and why it matters to every one of us. Let's dive in. Here's what we'll be covering today. We'll start with what telemedicine is, why it's needed, its benefits, current status, key applications, challenges, and a look into the future of telemedicine in Pakistan. Telemedicine is like having a doctor in your pocket. It allows healthcare professionals to diagnose and treat patients remotely through video calls, mobile apps, or even by sharing medical data digitally. Think about it. How many times have you wished you could just talk to a doctor without leaving your house? That's exactly what telemedicine offers. And during the pandemic, when hospitals were overcrowded or inaccessible, telemedicine was a lifeline for many of us. Let me ask you a question: why telemedicine in Pakistan is important? Did you know that 60% of our population lives in rural areas where healthcare is scarce? That's more than half of us who don't have easy access to hospitals. Anyone can relate to the struggle of finding a doctor in rural areas or having to travel long distances for healthcare. Telemedicine solves this problem by bringing healthcare to people, no matter where they live. You can consult a doctor without leaving your home. How cool is that? A recent survey conducted in Karachi revealed that healthcare providers are slowly but surely adopting telemedicine. The study concluded that healthcare professionals are adopting telemedicine, particularly in e-health clinics like Sehat Kahani. There's growing interest in learning more, with many already positive about integrating it into their work. With proper infrastructure and education, telemedicine can greatly improve healthcare access in underserved areas. Do you think more doctors in rural areas should start using telemedicine? Why or why not? This research shows that we're on the right path, but there's still a long way to go. As you can see on this chart, age really plays a role in how willing people are to use telemedicine. Younger folks are generally more open to it, while older people might be a bit more hesitant. Now, look at income. People with higher incomes are more likely to use telehealth services. It's no surprise since they often have better access to technology. Education matters too. Notice here, 69% of college grads are willing to use telemedicine, while only 61% of those with a high school diploma are. And finally, employment status. This is interesting. 72% of employed individuals are willing to use telemedicine, but it drops to 57% for those who are unemployed. So, this data tells us that while telemedicine is growing, factors like age, income, education, and employment still influence who's using it the most. Let's talk about the benefits. Telemedicine increases access to healthcare, especially for people living far from hospitals. It saves time, reduces costs, and helps manage chronic diseases more easily. It's also proven to reduce anxiety for patients who otherwise would have to wait in long queues. Now, quick poll. What do you think is the biggest benefit of telemedicine? Is it time-saving, cost-saving, or something else? Comment your opinion down below. So, where does telemedicine stand in Pakistan today? Platforms like Sehat Kahani and Oladoc are leading the charge. Even government hospitals are implementing teletriage systems to help manage patient flow. But, as usual, we still face some roadblocks, like internet connectivity in rural areas. Have you ever had an internet issue during an online meeting or call? Frustrating, right? Imagine that happening during a medical consultation. That's one of the biggest challenges we're facing with telemedicine in rural areas. Here's another chart showing the survey results on telehealth usage. 69% of respondents use telehealth for common illnesses and infections, while 66% utilize it for follow-up hospital visits. Additionally, 49% access talk therapy and 44% use it for chronic disease management. However, 24% still prefer in-person specialist visits, and only 3% choose other services. These results highlight the growing acceptance of telehealth, particularly for routine care and mental health support. The great thing about telemedicine is its versatility. From remote consultations to managing chronic diseases and even mental health services like telepsychiatry, telemedicine can cover a wide range of needs. These applications make healthcare more accessible, especially for those who might not feel comfortable visiting a hospital in person. Has anyone here had a telemedicine consultation for mental health support? How was your experience? Of course, telemedicine isn't without its challenges. The digital divide means that not everyone has access to the internet or even knows how to use the technology. There are also trust issues. Many people still prefer face-to-face consultations, especially for serious conditions. These are valid concerns, and we need to work on building trust in the technology and improving access to it. Do you think you'd trust a remote consultation for something serious, like a diagnosis? Why or why not? Now let's talk about the legal and ethical side of things. Patient privacy is a huge issue. Imagine your medical information being shared without your permission. We need secure data encryption to make sure telemedicine is safe. How many of you are concerned about privacy when using any kind of digital service, not just telemedicine? Yep, that's why strong regulations are needed. Ethical issues can also arise, especially when physical exams are required. Sometimes, a remote diagnosis just isn't enough. How many of you think telemedicine could become as common as going to a regular doctor's appointment in the next 5 years? What do you think it will take to get there? The future of telemedicine in Pakistan is looking bright. As technology improves and public-private partnerships form, telemedicine will become more accessible. We'll see better internet in rural areas and new regulations to ensure patient privacy and ethical standards. The telemedicine market has experienced remarkable growth in recent years. The global telemedicine market size is projected to reach around $590.9 billion by 2032, having generated $63.5 billion in revenue in 2022. This growth translates to a compound annual growth rate, CAGR, of 25.7% during the forecast period from 2022 to 2032. Notably, 45% of users express a preference for specific product components in telemedicine, indicating a trend towards tailored healthcare solutions. In conclusion, telemedicine has the potential to transform healthcare in Pakistan. With the right investments in infrastructure, legal frameworks, and awareness campaigns, we can make healthcare more accessible and affordable for everyone, especially in rural areas. So, let's spread the word about telemedicine. It's not just the future of healthcare, it's happening now, and we can all be part of the movement to make it more accessible. Here are the sources that back up everything we've discussed today. If you're interested in reading more, I'd be happy to share these references. Thank you all so much for your time and attention. I hope you leave today feeling more informed and excited about the future of telemedicine in Pakistan. If you have any question, do ask in the comment below. And don't forget to give your opinion on telemedicine.